So soft tissue is very important. Soft tissue is something that covers the root surface and protects the tooth. So you have two types of soft tissue. You have attached tissue, which is something that covers the root surface, and you have movable tissue, which is something that connects your lips and your cheeks to the underlying bone. The attached tissue is what's important because it's protecting the root surface. When you start to have recession is when your root becomes exposed and your soft tissue starts to come down. What happens is that root surface is not like the tooth. It's a different color and it's much softer, and it's much more permeable to the bacteria that cause cavities. So it's much easier to get a cavity on the root surface than it is to get a cavity on the tooth. So that's why we want to cover the soft tissue up, because as you lose soft tissue, you also lose bone. And when you start losing bone, you start losing support on the tooth. The tooth can become loose and the tooth can eventually fall out if the recession continues. We have a lot of different options to treat soft tissue, but the best option we have right now is something called the pinhole technique. The pinhole technique is something that is pretty new, and it's only done by I'm only one of 2,000 doctors in the world that performs this procedure. Basically, the way we used to cover root surfaces is we used to have to transplant a piece of tissue from the roof of the mouth, suture it down onto the root, make a flap, open the gums up, suture that back over the graft, and then it would be a pretty painful procedure for the patient. There's a new technique now with the evolution of dentistry where all we have to do is make a small hole in the non-attached tissue. And from there, going either from the top down or from the bottom up, we can move that tissue to cover the recession. There's no donor site, there are no stitches, there is no deterioration of the graft, there is no real pain for the patient as you had with the traditional graft surgeries. And then just push the tissue down, put in a little collagen, and we call it a day. Patients love it.